Thank you very much. Hi, everyone. Let's get going. A lot to cover today, actually, after a 4-day break. Over yesterday to today, the Ontario numbers have gone down a bit. 1,039 are the increase, the day-to-day increase from the last time in Ontario. And so we're stabilizing at the 1,000 or so level. The 70 average is about 1,600, which is about a 26% decrease from the previous days, which is good. Again, Toronto, Peel, and those areas are the ones that are pushing this. Ottawa had 48, so their numbers are declining in that regard. We In our area, actually, I'm very happy to report that we actually went. Yesterday, which was on Victoria Day, we actually had 0 cases to report. That's the first time in months that we've seen that, and so that is very good news. In fact, over the weekend, we went up 13. That includes Friday, Saturday, Sunday. 13 cases, if you recall. In the past, sometimes we've had weekends where we're 100, 150, and so this is very good news. Again, 3 in Cornwall and 10 in Prescott Russell in total over that period of time, and I think that's really very encouraging. And then what we're seeing now is we're kind of seeing sort of that stubborn down turn here, but you can see, boom, we've gone down and we're clearly in the orange range right now, and so that is very good news. And I'm hoping that we can continue this momentum moving forward. The downward trend. I think it's very good. As you know, we do have the reopening. The Reopening Act and Plan, the MAP, which was released last week. Over the weekend, we did have some openings of outdoor recreational amenities, including, of course, splash pads, marinas, private launches, and so on, with restrictions in place. And the gatherings were brought to 5 or less, outdoors only. And so that is good news. Again, we're expecting that we will be reevaluating this. The government will reevaluate this stay-at-home order next week, June 2nd, at which time there are a couple of choices. Either they would remove it and just continue everything status quo. Remove the stay-at-home order, but everything else remains the same, or they would extend it. I'm not sure what is going to happen. However, we do know that the approximate date of step 1, which would be opening of outdoor dining, opening of non-essential businesses with low numbers and so on, as well as increasing gatherings to 10, would occur around the 14th of June. Again, give or take a couple of days, likely perhaps earlier, depending on the numbers. Again, the numbers were based on percentage of population vaccinated, which is about 60% at that point, in terms of the trigger, and also numbers of hospitalizations. And I do see those numbers are going down, but the ICU numbers are still stubbornly in the 690 range or so. So that's something that we're going to have to keep an eye on. Speaking of vaccinations, a lot to report as well. We're now looking, this week, we're going to hit the 100,000 mark for sure. Right now, we're at 95,000 or so. Basically, that if you look at percent of adults vaccinated, we're at 60% at this point. If you look at 12 and above, we're at about 56%. We have now booked clinics through from May 25th to June 26th for another 46,000 places. Initially, we had put 28,000 places in up until June 12th, and we just submitted the other 18,000 a couple of days ago. It's not, and so they should be made available very soon to the public. Out of the 28,000 that were till June 12th, most of them were booked. If we're looking at the numbers moving forward in terms of our vaccination doses that we'll be giving as a first dose, by June 12th, we will have delivered, again, this only includes our vaccine clinics, approximately 128,000 vaccines by that time, which will bring us to about 77% of adults actually. And if we just put it over the denominator of 12 plus, it'll bring us to about 71%. Well, this is really good. We're really heading in the right direction. And by the June 26th, we will be at about 146,000 doses. Again, that's not counting pharmacies and primary care, which for the 18 plus represents over 85%. And for the 12 plus population represents about 81%. So these are excellent numbers moving forward. And we do anticipate that at some point there'll be a saturation of first dose, to which we will go to second dose, and that in fact earlier than the 4 months. I just want to talk about the second dose. We've been getting a lot of questions, a lot of emails, a lot of questions from the media as well, and the public about, I don't have my second dose. How can I get my second dose? Who will let me know, and so on. So I just want to give you a bit of an update that we got from the ministry. There are plans right now to have and not right away, but we will let people know that the provincial system will be open for people who can go on and book their second dose if they haven't had one when it's their turn, obviously. And or there'll also be the possibility of people going on to the website when we can say, okay, if you had your dose, if you're this age group or at this point in time, if you now we can give it earlier than 4 months. So for example, there are people that got their vaccine in April, and there will be a time over the next week or two that we will say, okay, now you can move your appointment up. All you need to do is go on the website and just move it up earlier on, to a vaccine clinic, of your choice that's available to you. And again, that'll be announced. Both those abilities are now being put in to the provincial system. And so please don't worry. We will not forget you. Your second dose will not be forgotten. In fact, I am actually hoping that we can get all the second doses done by the end of the summer. Because that's the one that's really going to be the key to opening up, our society again. So don't forget, again, we will not forget you. Don't worry. There are going to be mechanisms that will you'll be able to get your second dose appointment, either moving it up or or making it if you don't have it right now. We do have a list. We know exactly how many doses are due and when they're due, and we will have enough for you. So please do not worry. Again, stay tuned. As soon as we get the information from the ministry, I'll be more than happy to share it with everybody through media releases and so on, any which way we can get the information to you. So this is very positive that these are positive, both if you look at the trends of our numbers going downwards in terms of our cases. By the way, I forgot to tell you that right now we have no outbreaks. I know on the website it says one outbreak, but we just closed it just about half an hour ago, and we actually have 5 admissions to hospital, not 7. That's going to be corrected tomorrow. 5 total, with 3 in the ICU, and that's again significantly decreased from before. So that's good news all around. And again, we will keep you posted. AstraZeneca, I just want to give you an update on that. This will likely not affect our area, but mostly the people that received the vaccine in Kingston, in Windsor, and in Toronto area around March, those individuals can get a second dose of AstraZeneca from those pharmacies, and there's about 45,000 of them. And they will get it before the end of the month, because they will be given the AstraZeneca that will be expiring at the end of the month. For individuals who received AstraZeneca in our area through pharmacies and or through the primary care physicians, that you will receive an option, likely AstraZeneca second dose, once we get new doses. And again, there's a 12-week interval there. So again, stay tuned. Again, you will not be forgotten either. Bonjour tout le monde, je vais commencer avec les chiffres ontariennes qui sont beaucoup mieux qu'il y a à peu près un mois. On a augmenté de 1039 cas, donc c'est un très bon chiffre si on compare il y a quelques semaines. En effet, on a une diminution hebdomadaire de 26% à chaque semaine. Et toujours, les chiffres sont poussés par Toronto, Peel, York, Ottawa avec 48. Et dans notre région, je peux vous dire, j'ai été très surpris. En effet, en tout cas, je vais aller juste voir Une seconde, je vais partager mon écran. J'ai été pas mal surpris cette fin de semaine car on n'a eu aucun cas de rapporté hier, aucun cas positif. Et puis ça fait des mois, je ne me souviens pas quand c'était la dernière fois qu'on n'avait aucun cas. Et pendant la fin de semaine, nous avons ajouté 13 en total, vendredi, samedi, dimanche et hier. Donc, c'est très bon pour nous. En effet, on voit qu'on n'avait aucun cas SDNG, 10 à Prescott Russell et 3 à Cornwall. Et donc, si on voit le niveau de moyenne mobile, on voit clairement qu'on est dans zone orange ou entre orange et jaune actuellement. Donc, vous voyez clairement qu'on a diminué. La tendance continue à descendre. Ça, c'est de très bonnes nouvelles pour nous. Je pense que ta réponse au niveau des ordonnances et les fermetures qu'on avait faites. Il faut dire aussi que sur mon site web, on démontre une flambée, mais c'est rendu à 0 actuellement parce qu'on vient de fermer la dernière qu'on avait. Et on marque 7 hospitalisations et 3 soins intensifs. En effet, c'est 5 hospitalisations. Ça va changer demain. Ça, c'est toujours... Tous les chiffres vont dans la bonne direction pour le Bureau de santé de l'Est d'Ontario. Et ceci nous reste aussi pour dire que la fin de semaine passée, on a augmenté, on a changé un peu, on a ouvrir les parcs, les terrains de golf, tennis, etc., tous les jeux récréatifs à l'extérieur étaient ouverts, était possible de jouer, etc., avec 5 personnes de maximum de rassemblement à l'extérieur. Comme vous savez, on va avoir des étapes, première, deuxième et troisième étape de réouverture qui vont commencer à peu près le 14 juin. Avec la première étape, quand on a 60 de la population de vaccinés et quand on a les chiffres en diminuant de façon satisfaisante. Donc, ça se peut, étant donné qu'on voit les bons chiffres en diminuant, ça se peut on rentre au stade, aux premières étapes quelques jours avant. Donc, c'est une chose à suivre pour nous parce que c'est très important de continuer à la bonne direction et aussi avec le pourcentage de vaccination de 60 et plus de première dose. Donc, en parlant de vaccination d'aujourd'hui, on est rendu à peu près à 95 000 doses et ceci donc à peu près 100 000 en total, disons. Donc, ceci nous met, si on compte les 18 ans et plus, on est rendu à 60 de la population vaccinée. Si on compte la population de 12 ans et plus, à ce moment-là, on est rendu à peu près 56 de la population vaccinée. On a ajouté déjà 46 000 places d'ici le 26 juin. Et en effet, entre le 25 mai et le 12 juin, on a 28 100 places qui étaient disponibles et il reste à peine 1000. Donc, on a ajouté une autre 18 000. Donc, en total, on a ajouté 46 300 places d'ici le 26 juin. Et à ce moment-là, si on voit que d'ici le 12 juin, on aura vacciné une autre 28 000 personnes, et ceci ne compte pas les pharmacies, ça ne compte pas les hôpitaux, etc., les soins primaires, on va être rendu le 12 juin à peu près à 77 de la population 12 ans et plus, et 18 ans et plus, et 71 de la population des personnes 12 ans et plus. Et en mois de juin, après les cliniques qui vont se faire, qui va prendre place d'ici le 26 juin, on va être à peu près à 146 000 personnes de vaccinés et ceci représente 88 de la population 18 ans et plus. Et si on compte 12 ans et plus, ça compte à peu près 81 de la population vaccinée. Donc, on part d'ici le 3e à 4e semaine de juin. Donc, vous voyez, on va dans la très bonne direction c'est une chose à suivre. Donc, je suis très content. Donc, je suis optimiste qu'on va commencer doucement à commencer à vacciner les deuxièmes doses. En effet, j'ai beaucoup de questions du média et aussi des personnes qui nous envoient des courriers électroniques et qui nous appellent le bureau de santé. Ils ont peur, quand est-ce que je vais avoir mon deuxième rendez-vous? où est-ce que je peux changer mon deuxième rendez-vous. Donc, je peux vous dire que, inquiétez-vous pas, il va y avoir des mécanismes qui vont vous, vous auront la capacité de aller faire un deuxième rendez-vous sur le site provincial ou soit par téléphone et ou d'aller changer votre rendez-vous de deuxième rendez-vous parce qu'à un moment donné, nous allons annoncer que certains âges et après un moment donné, les personnes pourront aller changer leur date du deuxième rendez-vous ou dose pour un peu une date plus tôt parce que on va avoir vacciné, comme vous voyez, 75-80% de la population d'ici le mois de juin. Donc, on aurait la capacité à commencer à vacciner les personnes beaucoup plus tôt que les 4 mois entre les deux doses. Donc, ça, c'est des très bonnes nouvelles. Et si on continue avec tout ça, avec le débit pour lequel on pourrait fonctionner dans nos cliniques de masse immunisation, et aussi si ça continue avec le débit de vaccins qu'on reçoit de façon de chaque semaine, on va être capable de vraiment avoir vacciné deuxième dose, en effet, complètement plus que 75% de la population d'ici fin août. Donc, ça, c'était très bonne nouvelle. Et aussi, donc, je veux juste souligner que je veux rassurer les gens qu'on ne va pas oublier votre deuxième dose. On veut que tout le monde recevra le deuxième dose et il y aura des mécanismes qu'on va annoncer à tout le monde comment vous pouvez booker votre deuxième dose si vous n'avez pas déjà un rendez-vous ou si on annonce que vous pouvez le mettre plus tôt, à ce moment-là, il y aura des mécanismes qu'on va annoncer à tout le monde. Donc, inquiétez-vous pas. Je vais juste parler un peu de AstraZeneca avant que je finisse. AstraZeneca, comme vous savez, va être disponible comme deuxième dose pour les personnes qui ont reçu leur première dose au mois de mars à peu près. C'était plutôt à Kingston, à Windsor et à Toronto. Il va y avoir des places disponibles pour les pharmacies qui l'ont donné à ces places-là. Donc, les personnes vont être obligées de contacter les pharmacies ou les soins primaires pour le faire vacciner le deuxième dose parce qu'il reste à peu près 45 000 doses qui vont expirer d'ici le fin mois. Donc, on va vacciner avec ça. Les récentes personnes qui ont reçu l'AstraZeneca, comme dans notre région, nous avons donné de l'AstraZeneca dans nos pharmacies et aussi dans les soins primaires. À ce moment-là, probablement, fort probable, on va vous offrir une deuxième dose du AstraZeneca, mais dans une période de 12 semaines. Donc, une fois que tout est clair, encore, ça va être annoncé et inquiétez-vous pas, on ne va pas vous oublier. Donc, on a des bonnes nouvelles. On voit des chiffres qui vont dans la très bonne direction au niveau de nos cas dans notre région et aussi qu'on prévoit. Et actuellement, on voit un très bon rythme des vaccins. Donc, tout ce je suis très encouragé et je pense qu'on devrait juste continuer un peu. On a une autre semaine pour qu'on puisse vraiment essayer de continuer à respecter tous les normes, toutes les précautions de santé publique et on va rentrer sur la première étape. Et ça se peut, si les chiffres sont bons, qu'on rentre aux premières étapes quelques jours avant le 14 juin. So I want to answer a few questions here. Quelle est la situation avec le jeu de feu? En effet, ils ne sont pas interdits, mais les rassemblements sont interdits. Rendus au 1er juillet, à ce moment-là, on aurait des limites très limitées des personnes qui pourront se rassembler. Donc, si les personnes ne devraient pas se déplacer, on peut le faire. Question was about fireworks. I know July 1st is coming. By that time, we're not going to be in the position to have big gatherings. At that point in time, we will be still in step one, which will only be minimal gatherings outside. So I know that some municipalities may have canceled, others may continue, but maybe you could do it from home. But really, they still can't have big gatherings at that time. It'll be too early. I have another question from James Morgan. Have we received any indication about the OPP checkpoints entering in Ontario? When I suspect those will end when the stay-at-home order is removed, and I'm not sure what they're going to do after that, but that's what I'm presuming. I addressed the second dose. J'ai une question du Radio-Canada. Pourriez-vous me dire combien de rendez-vous on a réservé hier dans la région de bureau de santé de l'Est Ontario pour le groupe de 12 à 17 ans? Je peux vous dire que c'était est 2239, qui représente à peu près 18% de toute la population à cet âge. Et nous avons la place, nous avons les places d'ici le mi-juin pour combler les autres aussi. J'ai une autre question au niveau, est-ce qu'il y a de préférence, est-ce qu'on voit une préférence de Pfizer plutôt que celui de Moderna dans notre région? Non, pas encore. Je pense que les deux vaccins sont bienvenus par notre population. Nation Valley medics, long-term care facilities, there were people that died being vaccinated twice. Nelson, it's a long story, but let me give you a short answer. I want to give you a comparison. With influenza vaccination, we do not have a 100% rate. We have at best 60, 70%, or if not 80% percentage positivity protection for seniors, particularly in long-term care. And what happens at a long-term care home, when we have an outbreak, we do get people who have been vaccinated and have these breakthrough infections. We see that all the time with influenza. And so what happens in that situation, to protect everybody, we have antiviral medications, we have protocols in place, and we give everybody, regardless of vaccination status, and most of which are vaccinated, we actually give them an antiviral medication, Tamiflu, for a 7 to 10 day course to prevent it. We don't have that with COVID. So what happens is, even if you have a high percentage of 70, 80, 90%, there's still that 10% chance. So tragically, that's what happened there. Now, the other question is about variants becoming resistant. Again, depending on what vaccine it is and what variant you're talking about, there can be some what we call immune escape variants. In that regard, I know that there is capacity to add those two current vaccines and give boosters. So in the long term, this is how we will be controlling that. And I have a couple of questions here from Standard Freeholder. Have there been any new cases as a result of outdoor recreation this weekend? Too early to tell. I hope not. What's the province's plan or decision on reopening schools? Good question. I forgot to address it. My suspicion is that we might get an announcement that schools may open May 31st. This is my suspicion. I, as Como chair, and I co-signed a letter with the CEO and president of the Sick Kids Hospital asking for reopening. I suspect that there's a lot of people supporting that. So I do believe that schools there will be an announcement. Again, I'm not sure, but my sense is that yes, and likely May 31st, perhaps not in the Toronto area, but other areas in the province. Je veux dire ça en français parce que c'est au sujet des écoles, de réouverture des écoles. Moi, j'ai l'impression qu'il va y avoir une annonce bientôt pour ouvrir les écoles le 31 mai. Je ne suis pas sûr, ça c'est mon feeling. Je peux vous dire que j'ai signé une lettre comme président du médecin hygiéniste d'Ontario, l'association, et qui a été co-signée avec mon confrère de Dr. Cohn, qui est le président du Sick Kids, l'hôpital Sick Kids à Toronto, demandant au ministère de l'Éducation d'ouvrir les écoles parce qu'on veut diminuer tous les effets nocifs et négatifs qu'on voit chez les enfants et bien sûr sur les parents. Donc peut-être même un mois de retourner à l'école, de retour normal, va être bon pour leur état psychologique, à mon avis. Donc je pense qu'il va y avoir une annonce bientôt. Is there a plan to allow greater freedom to people who receive their 2 doses compared to the whole province? The plan is provincial. It will be looking not only in terms of 2 doses, doses and percent of the doses. We'll also be looking at, obviously, a percentage of hospitalizations and so on, and numbers. So we are working on plans of how, at what point, people will remove their masks, and what point there will be advantages, if you like, or specific freedoms or other liberties to individuals who have been vaccinated versus those who have not, and that's being worked at right now. And that's it, Jenna. I will take some questions.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul.
Hi, Philip.
So my first question is really a follow-up to what I asked on Thursday about the emergency brake, allowing non-essential retail at 25%, but step 1 of the new plan on June 14th would have that at 15%. Do you have any more insight on that?
No, I do not.
Okay. Okay.
I forgot.
That's okay. I'm just doing my job.
No, I don't. All I know is that there'll be 15% for non-essential and 25% for essential. I think whatever it was. Yeah.
Yeah. Okay. Do you think, second question, Dr. David Williams said that we need to be about 1,000 cases a day in order to consider reopening, which we hit that plateau this weekend. Do you think that the step one will be moved earlier than June 14th?
You know what? It's a possibility, but I can't guarantee it. One of the things that's holding us back, Philip, is we're looking at immunization numbers, case rates, as well as ICU and hospital admissions. And as I said before, today I was looking at the numbers. I think we're at 692. Like, they're going down very slowly, the ICU admissions, although the overall admissions have gone down to 1,200, I think, or something like that. So they're down 20%, but the ICU admissions are sticking there. So I think that people have thrown out, for around the 400 or 500 mark, that would be something. So we're looking at something like that. Again, they're going to have to there's no like weighting of them, but you have to see what the overall context is. So yeah, I have a feeling that it may be a bit earlier, but not that much earlier.
Okay. And lastly, this is actually a question that I received today in a phone call from a reader. So I said I would ask this one. She was concerned that why some stores like pharmacies are allowed to sell greeting cards and office supplies, yet dollar stores and grocery stores are not. Is this just a matter of different interpretations by different businesses, or is there some regulation issue there?
There's no regulation issue. I think it's a misinterpretation. Technically, they should only be selling essentials.
Okay. Thank you.
You're welcome.
Next question, Eric O'Brien, City News. Please go ahead.
Sorry, I was trying to unmute myself. How are you?
Great yourself, Eric. There you go.
Hey, I was just curious about, actually, there was a tweet that came out just before you started the press conference from the Chief Medical Officer of Health saying they don't know, saying he doesn't know if or when schools will be able to reopen, but suggests that there could be some type of reopening to in-person learning in regions that are less affected by COVID-19. Now, I have to ask, because of how many cases you're reporting today, what's your thought on this approach?
Well, my thought is, we were asked this a couple of weeks ago, Eric, and we had said that if the numbers continue to go down, we'd be very comfortable with a regional reopening, by the 31st. So I do believe that there are regions and the big parts of the population in Ontario, outside of GTA, that are ready to open May 31st.
Okay, so that's kind of what you're thinking. That's kind of what you were saying before about you expect news to come.
Yeah, I expect news to come. I actually had some conversations with the Ministry of Education, and over the weekend we had a meeting with multiple ministers, including the Premier, and we said that we thought that it would be safe to open, and they're taking that under advisement. We'll see.
Yeah, I look forward to finding out more. Now, my second question is kind of two-pronged. I guess, what are you hearing from people these days? I mean, we talk about pandemic fatigue. We talk about loosening restrictions on the way, that light at the end of the tunnel. It's kind of, I don't know if it's a bit frustrating for people that have been following the rules very closely. But are you seeing that people are starting to get fed up in your region? What's going on there?
Yeah, I do see people are fed up, but I also see people happy. I mean, I see we see thousands of them, coming to our clinics, and they're just happy that they're getting their vaccine and there is some kind of a light at the end of that tunnel. I can tell you, one of the things that adds to I think people's distress, for lack of a better word, is notwithstanding, pandemic fatigue. And you saw this morning a Carleton article, Carleton study looked at parental fatigue and mental health and so on, like stressing everybody, businesses and so on. Notwithstanding those, there's also other areas in Canada and the United States that are opening quicker than we are. And I think that's adding to the stress. So why aren't we opening as quickly as they are? Why aren't we opening as quickly as they are? And I think that's adding to the frustration. And all I can tell you is that, I was looking at hockey games the other day. There was 15,000 people, I think, in Nashville. And I'm like scratching my head. And their vaccination rates are the same as ours. And their rates are, in the thousands as well. Like, there's similar numbers. So I think it's a matter of them going too early than us not going fast enough. If that's my personal opinion.
Mm-hmm. Now, just the second prong to my to this question: how do you keep people on board? How do you bring them back?
You explain to them exactly what I told you today in terms of we're doing the right thing. The numbers look at our numbers. Our sacrifices are now bearing fruit. Our vaccines are coming. This is our plan. This is what we're going to do this date. That's what you can do in that date. That's the only thing we can do, and just reaffirm that. And we also tell them that we want this to be the last lockdown. That's very important. Because if we open up too early and then have to retract, that will be even worse. So we're just trying to keep it a positive light, show them that we're going in the right direction, and we also have now even some loose timelines, but their timelines are there. They're not abstract. They're there.
Thanks, Dr. Paul.
No problem.
Prochaine question, Denis Babin, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul.
Bonjour, Denis.
Vous le disiez tout à l'heure en anglais, on se fait continuellement poser la question, on vit dans des communautés frontalières. La réouverture de la frontière va-t-il coïncider avec la fin de l'ordre de rester à la maison?
Je pense que oui. La question est si ils vont prolonger jusqu'au qu'on rentre aux premières étapes ou si ils vont arrêter, ils vont cesser l'ordonnance le 3 juin. Je ne suis pas sûr.
Dr. Paul, oui. Est-ce que le Bureau de santé a atteint sa vitesse de croisière quant au nombre de personnes vaccinées sur une base quotidienne ou bien vous pouvez encore augmenter la cadence?
Je pourrais l'augmenter, la cadence pourrait augmenter et on est limité au niveau de la limite de vaccins qu'on recevra. Le débit va augmenter un petit peu parce que là, on va commencer à donner beaucoup plus de vaccins dans nos cliniques parce que même une clinique comme par exemple Hawkesbury, on pourrait aller jusqu'à 1200, 1300 cas semaine aussi. Avant, on donnait comme 900, 295 parce qu'on n'avait pas assez. Mais oui, on pourrait soit ajouter des cliniques et soit, dans chaque clinique, augmenter le débit, le numéro de personnes qu'on pourrait vacciner dans une journée.
Donc, là, c'est une question d'approvisionnement, c'est ce que vous dites.
Oui, c'est pour ça que moi, je prévois qu'une fois qu'on a vacciné un bon pourcentage de première dose, comme je pense ça va aller mi-juin à peu près, on sera capable de très, très vite commencer à revacciner pour deuxième dose. Et je pense qu'avec le débit qu'on va recevoir les vaccins, on pourrait avoir fini la deuxième dose, je pense, très fort probable d'ici le fin août, début septembre.
Merci beaucoup, Dr. Paul.
Pas de problème.
Next question, Ryan Jones, CBC News. Please go ahead.
Hi, Dr. Paul. Thanks for taking the question. Just wondering, what impact, if any, do you think today's announcement that the Outaouais in West Quebec will be gradually reopening and loosening rules at a pace kind of quicker than we are here in Ontario?
That again, so kind of related before to the other question that I answered. I do believe that it will increase people's anxiety and people's impatience locally, but I also think that we need to do a go slow approach. We had more ICU admissions than they did. We still have high ICU admissions at this point. I've compared the numbers, so we're not at the stage at this point to be able to start opening up like they are, but it's just a matter of time. It's a couple of weeks. We're not talking years, and we're not talking indefinitely either. We have concrete dates, and I think that people should be aware of those, that our situation is a bit different than it is in Quebec, both in terms of where they are in terms of the numbers, and particularly with the ICU admissions.
Great. And I just have a question about the second doses. You said you were talking with the Ministry of Health about the plan to add an option on the provincial booking system in the coming weeks. I'm wondering if you have any information about whether does that only apply to people who booked through the provincial booking system in the first place, or will people who say got their first dose at a pharmacy also have that option to book their second dose that way?
There will likely be an interconnectivity between all of those, and I've asked that question as well. That's a good question, and one of the things that we got is that yes, if you got it at your pharmacy, we'll be able to know if you received it or what it was, and you can be able to book in our clinic. Let's say you had Pfizer vaccine, we'll give you a Pfizer vaccine. So there'll be interchangeability because we're all using the similar system.
Great, thank you.
I just want to add one thing, and I'll say it in French. I got a call from our local MP, and I got a couple of emails about snowbirds and people receiving vaccines out of province, particularly around the Hawkesbury area, New York, and Akwesasne area, and so on, and snowbirds returning where they've got full doses of vaccines. And we need somehow to register those. So the ministry told us over the weekend that they're very aware of that, because it's hundreds of thousands of people. We have hundreds of thousands of snowbirds that go to the south, as you know, and people that cross the border all the time. So there's going to be a mechanism, not right away. We will announce it shortly when it's available, that individuals who got vaccinated in other jurisdictions outside of Ontario will be able to send to a public health unit, local public health unit, proof of vaccination. And then we'll be able to input that in with their information so they could be registered as being vaccinated Ontarians. Donc, je veux le dire en français. J'ai reçu un appel la semaine passée d'une des qui me demandait, et une lettre aussi, qui me demandait qu'est-ce qu'on fait avec les personnes qui ont reçu leur vaccin en dehors d'Ontario, comme on a 300 000 personnes qui vont aux États, par exemple, chaque année. On a des personnes à Québec qui travaillent à Hawkesbury, dans notre région. Comment on saurait, ou des personnes, en effet, qui reçoivent leur vaccin en dehors d'Ontario, comment est-ce que ça va rentrer dans nos systèmes pour qu'on puisse compter sur le pourcentage, etc. Donc, la réponse est à peu près le début juin, il va y avoir une capacité de nos systèmes que si une personne était vaccinée aux États-Unis ou en dehors d'Ontario avec les 2 vaccins, nous, on aurait un mécanisme pour le faire enregistrer, pour vraiment confirmer qu'il a été vacciné. Donc, on pourrait compter, si on veut compter le pourcentage de la population vaccinée, on pourrait les compter aussi. Donc, c'est pas encore disponible, mais ça va disponible à peu près la première ou deuxième semaine de juin, mais sûrement on va le partager avec tout le monde.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul.
Hi, Natasha.
So do you know if Ontario has any early numbers about how many people contracted COVID-19 after being fully vaccinated?
There was a report that came out. It was a very low number. I don't have it with me. There was a report by Public Health Ontario that actually talked about breakthroughs. They were very, very low. I think 0.06%, very low. And they were even lower with 2 doses, but I don't have it on the top of my head. I know that the Public Health Ontario website has that information about breakthroughs over, at the time, there was about 3.8 million doses.
Okay, thank you so much.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you, Jana. Merci.